Okay, this video is going to be chapter 1 of my new book, The Poor Man's Way to Prevent Dementia and Raise IQ. Subtitle is How to Keep Your Brain and Your Boner. Okay, shrink this picture down here so we can see it. There's lots of illustrations in this book, like 250 of them, something like that. Okay, just came out this December, just a couple days ago. First arrival of the hard of this. It's a paperback. All right, so here's the copy. The table of contents, Boreward and Tory theory, dementia. We're going to do first. Okay. Okay, here's a disclaimer. You know, one of my literary heroes, Oscar Wilde, even though in regular life he's a bit of an idiot, but I do still like him. I love Irish writers. I have nothing to declare about my genius, which he said when he came to America. Also, this book is for educational purposes only. It is not medical advice. I am not your doctor. I am just a lonely old autistic hermit who writes these books because I have nothing else to do. Dietary change can have a powerful effect on blood pressure and blood glucose. If you're taking any medications, you should let your doctor know before changing your diet because you might need to titrate them down to change your dosages. The next thing is a quote from Thucydides. Okay. Oh, I gotta get out of the way here. My history has been composed to be an everlasting possession and not the showpiece of an hour. This book is written not for the applause of the moment, but as a gift to mankind for all time. Yep, I agree with that. Thucydides, he was like the admiral. He got in trouble in the Athenian War between the Spartans, and he actually kind of got fired from his job, but he was an expert on everything, and he wrote a masterpiece book about it. The history of the Peloponnesian War is a masterpiece. Okay, now, another Oscar Wilde quote. He reviewed my book. As a writer, he has mastered everything except language. As a novelist, he can do everything except tell a story. As an artist, he is everything except articulate. He has nothing to say and says it. Great. Ralph Waldo Emerson. Whoso would be great must be a nonconformist. That's very true. Anybody who's a conformist in medicine, they're going to be mediocre because all the conventional books stink. Okay, Peter Rogers, MD. Warning, I'm the bad boy of nutrition. I'm going to make fun of your stupid habits and the phony pseudo-experts who you probably follow on the internet. So here I am trying to be clever, and I misspelled pseudo-experts in the official version of the book like a dumbass. Okay, here is a picture, the first illustration of the book, basically making a joke about the story that, when I was a kid, there was cartoons on TV that, only an idiot would go to a witch doctor and the witch doctor is going to give a magic potion. Aren't they stupid? Okay. But in reality, what do Americans do? The same thing. They go to a doctor who's going to give you a bunch of pills, a magic potion, and, how is that any different? I don't see how it is. Okay. And then, of course, what it comes down to is people think, oh, well, these are special research-tested medicines. Yeah, right. The pharmaceutical companies, they buy all the journals. They publish whatever they want. It's a big joke. And the old saying is, you cure a patient, you lose a customer. There is no incentive to cure patients with chronic diseases. That's why they never get cured. And they don't teach medical students about diet and nutrition. By the way, I'm going to ad-lib a ton. So this is not going to exactly be the book. It'll be the book plus a whole bunch of ad-libs. Conventional medicine doesn't want to cure the patient. They really, really, really don't. Let's see. But nutrition can routinely cure these diseases. It cures patients all the time, tons of them. So that's why conventional medicine considers itself the official standard, but in reality, it's kind of a joke for the chronic diseases, the common diseases of Western civilizations. Okay, what's the cure for pills, stents, surgery for coronary artery disease? It's about 0%. What's the cure? The patient takes the pills for life. They don't treat the microvascular disease. All they can do is treat the outer big epicardial coronary arteries with bypass and stents. But it's everywhere. It's diffusely in the small vessels, in the vessels that go into the cardiac muscle, the myocardial branches, intramyocardial branches. Okay, and they get tons of recurrent events, and eventually die of heart attacks quite often. Okay, so what's the cure rate for low-fat vegan? Esselstyn's diet's close to 100% if they actually follow the diet for curing coronary artery disease. Okay, and you don't have to take any pill. You just have to follow the diet, which is low-fat, low-sodium vegan, which anybody who knows anything about nutrition follows that anyways. Okay, and the cure rates are also very high for obesity, hypertension, diabetes. Okay, so anybody who knows the truth, it's obvious. The most valuable thing you can learn is nutrition. Okay, I would actually say, one of the reasons why I'm always grateful to McDougall put it all together into a systematic format. He said, look, you want to be healthy? Eat starch. And here's why you eat starch, because it's low caloric density, meaning that it stretches your stomach early so you get satisfaction, hunger, early satiety. And then the fiber has to be peeled off from the food. Starch is basically a polymer, glucose, a plant food. And then you get slow absorption of the glucose once it's separated from the fiber, and that keeps your blood glucose in the normal zone a prolonged amount of time. And because you satisfy your hunger with the least number of calories, you optimize your body weight. And the skinniest populations are the ones that eat the lowest percentage of calories from fat. Rice, white rice, potatoes, sweet potatoes are all 1% fat. So populations that eat that, they're all skinny. And the populations that eat the lowest amount of fat have the least amount of atherosclerosis. And I've also told you that before. That's why I think the modern, all these popular nutrition experts, the ones that get invited everywhere and everybody loves them, their books get 1,000 reviews. My books will get 0 to 1 review. All right? And nobody knows me, and then I'm known as the bad boy and, a jerk because I have an opinion and I tell the truth and I'm not a conformist. Okay? Too bad. I'll do this as long as I can. So anyways, what I'm trying to say is, if you lie to the public and you tell them a bunch of crap, coffee's good for you, olive oil is good for you, and you promote all these corporate products, you get millions of views on the internet, you're invited everywhere, and everybody says, oh, aren't you nice, aren't you good? If you tell the truth like me, you get labeled as a jerk and a big mouth, but that's what the people need, so I'll do it, okay? All right, this is the same old story about, doctors themselves tend to not be that healthy. A little healthier than the average chump who eats a sad diet, but they still are only about 10 years ahead of the game. Low-fat, low-sodium vegan, you're like 15 or more years ahead of them in terms of health, and going to live longer, have a longer health span, if you will. Okay, so in this book, I talked about the normal distribution. Only about 1% of people even have a moderate understanding of nutrition. I label the average person an ADS, average dumb shit, and it's kind of a joke on the old book of Mystery Method about AFC as the average frustrated chump, and I'll put a WP as the wise person. ADR, average doctor. You'll see these abbreviations a little bit through the book. Health aristocrats are the low-fat, low-sodium vegans. Why should you read this book? I said, because I'm the best expert in the world in preventing dementia. And I'm going to say that I don't even think those other guys that you probably know of, like the Schurzey's, are even in my ballpark. They're like in maybe the ballpark next to my ballpark, but they're not even in my ballpark, or maybe even the ballpark next to my ballpark. And I say that because how could you write a book about dementia and recommend a high-fat diet? In my opinion, that's stupid. They're recommending all these fats, omega-3s, nuts, seeds, flax. It goes on, olive oil, and then coffee. That's like opposite of what I would recommend. And I know more about it than any of them, okay? Bredesen's the same type of crap, and then all these famous people you've heard of. Compare my book to any of them. Compare my book. Put it in the comments. If you think they're right and I'm wrong about something, please put it in the comments. I'd be happy to hear. Let's have free speech. Share it with everybody. Okay, and then, McDougall's a great nutritionist, but when he starts talking about the brain, he's kind of out of his element, He knows aluminum, and that's great. There's a lot of problems with aluminum, but there's a lot more to it than that. And then these other guys, these famous scientists that write about the brain all the time, they know one little silo. I've read everything I could from all the different fields, and I talk about it, okay? So you will see anybody who really sophisticated knows a lot, because I have a lot of friends that are fellowship trained neurologists, and I guarantee you they don't know this stuff. It's way beyond them. So if it's way beyond them, they know more than anybody else pretty much on the brain. I think you're going to find that. And what I do is I empower you. I'm the one who's really empowering you. I'm telling you this is what you can do to keep your brain function. Okay, and I'll tell you the truth about all this stuff. The other thing, too, is, I'm 60 years old. I don't get any diseases. I don't take any pills. I've never had a surgery in my life. And then they also say, oh, you got to eat a lot of protein or you're going to be weak. You're going to be sarcopenic. Bullshit. I eat like 10% or less of protein. I can do 78 push-ups in one set real fast. More than all the young guys I know. So it doesn't mean you're weak. Look at the Tata Humar. They can run 100 miles in 2 days. And they eat a low-protein diet. Same with all the blue zones. They're all eating pretty much low-protein diets pretty much. I'll eat a little beans, but there's such a small amount, it ends up not overall having that big an effect on my protein amounts. All right, you got to know Jack Delatore's theory of chronic cerebral hypoperfusion. That's the one where he tied off the mouse's carotid artery. 2 months later, the middle-aged and older mice became demented due to a lack of blood supply. Chronic cerebral hypoperfusion. They didn't stroke. It didn't happen rapidly. It happened gradually by apoptosis. And my theory of neurovascular coupling, basically when metabolic rate gets too far away from oxygen and glucose delivery, neurons die. I'll explain that in a lot more detail in a moment, but that's what you need to know. So Jack Delatore, I'm just going to call him Tory because it's easier than saying all that stuff. When he did autopsies on the mice, there was no big stroke. It was just apoptosis, atrophy of that part of the brain, and that's a real key thing. Okay. And Tori, by the way, and mine are the two best theories of dementia. There's nothing else even close because they tell you exactly what to do. You'll understand almost everything about dementia when you understand. You just basically ask yourself, how does it relate to the Della Torre theory? How does it relate to the Rogers theory? And if you do that, it'll all make sense. Okay. I jokingly call it glucose and oxygen delivery, GOD. You know, it's a bit of a joke, okay? A lot of times in the journal articles, you'll see it called OGD, oxygen and glucose delivery. Apoptosis means programmed cell death, where a neuron dies slowly and recycles its components so they can be sent to other cells. And that's why you don't see anything on a brain MRI. Even at autopsy, you just see a paucity of cells rather than any major focal pathology. Okay, let's see. And the other thing too is people say, oh, well, not that many people have a complete carotid occlusion. Well, so what? They got tons of things that are the equivalent, okay, like chronic cerebral hyperperfusion due to overtreated hypertension, intracranial atherosclerosis due to diabetes and hypertension. Okay, how about AFib? Inadequate filling of the left ventricle. You're like, I call it a mouse equivalent. You're like the mouse. Chronic cerebral hypoperfusion. Okay, and that's also sometimes called the vascular hypothesis of dementia or the vascular hypothesis of Alzheimer's. But in my opinion, I don't even like the word Alzheimer's. I think it's stupid. I think the whole Alzheimer's is stupid. If you talk to all the Mickey Mouse pseudo experts, are going to tell you, oh, Alzheimer's is the most common cause of dementia. And what I'm going to say is BS, that they don't even know what Alzheimer's is. And the reason is, what's the historical finding? You ask the patient and you can diagnose Alzheimer's. There is none. There's no specific unique historical finding. What is the physical exam finding? There is none. There's no physical exam finding that's definitive. What's the blood test that's definitive? There is no blood test that's definitive. And you say, well, of course, we can diagnose it with one of your imaging scans. No, there is no imaging scan that's definitive for it. The cognitive reserve patients can have Alzheimer's, plaques, beta amyloid, all the stuff in tau. That doesn't mean that they've got Alzheimer's, okay? They can be cognitively intact. You say, well, certainly at autopsy we can diagnose. So we know, we heard about Alois Alzheimer, and that he originally said there's, extracellular senile plaques of the amyloid, and there's intracellular tau, neurofibrillary tangles. Then we can diagnose. No, BS. They can't even tell at autopsy if the patient has Alzheimer's or not. So what I'm saying is, what would you call a disease where you can't diagnose it by history, by imaging, by lab, by autopsy? You'd say that's BS, and there's no treatment for it, okay? It's all a big crock of BS to sell drugs, okay? It's stupid. All right, we talked about how overtreated hypertension causes intracranial atherosclerosis, dropping oxygen and glucose delivery to the tissue. And then if you overtreat the hypertension, drop the pressure too low. Some old guy, why has he got 170 systolic? To get blood to his brain. You drop that suddenly to 120, he's done got blood going to his brain. He's like the mouse, okay? You want to stay in the Goldilocks zone, the Aristotelian golden mean, okay? And if you don't have that, you're screwed. You're going to start losing brain cells to apoptosis. Okay, diabetes also damages the arterial wall. All right. And then I was talking a little bit more about Tori. Tori wrote a great book, Della Torre. His book's called Alzheimer's Turning Point. It's a masterpiece. All right. A lot of old people have aortic regurgitation, aortic stenosis, chronic cerebral hypoperfusion. They're like the mouse equivalents. Okay, and then Tori still got more. He says, what about coronary artery bypass graft patient when they're intraoperative and they're hypotensive, which they do? I told you my father, I stayed with him in the ICU after he had open heart surgery. I wanted to talk him out of it. It was many years ago, like 25 years ago, and I didn't know enough then to come down strong. I kind of got bullied by the cardiologist and the surgeon. He needs open heart surgery, and I didn't know enough to say, no, he doesn't. I said, I don't think he does, but I wasn't the confident expert that I am now back then. I knew the right thing, but I didn't come down strong, and that's not enough. You got to be able to speak strongly on your position to hold it up in a big argument with experts. Okay, so anyways, they ran my dad's post-op blood pressure after open heart surgery. CABG means coronary artery bypass graft. They ran him about 90/60, and I asked the anesthesiologist, why are you doing that? They go, so he doesn't bleed out at his anastomosis where they plugged in the bypass grafts. Luckily, my dad was a pretty healthy guy, so he tolerated it well, but a lot of people get what's called pump head. They get dementia, cognitive impairment after open heart surgery because the pressure was kept too low. All right, so now Tori made some interesting comments about Ronald Reagan. Ronald Reagan was the old El Presidente, and back when he was the governor of California, it was a rich state. I remember college tuition was free. Los Angeles was a paradise instead of now becoming a third world, homeless shelter crap hole. Okay, so anyways, what's the point? When Ronald Reagan took one for the Gipper, he dropped his pressure and he was hypotensive for a prolonged amount of time, and that appears to be the reason why he became demented not that long after that. Okay, so it basically is a perfect example of Della Torre's mouse equivalent theory. All right, So that's rather interesting, don't you think? Um, let's see what else. Oh yeah, and by the way, typical story. So here's Delatorre comes up with this brilliant theory. He did tons of experience in mice, tying off their internal carotid in their neck, tying off their intracranial middle cerebral artery, tying off both carotids, tying off the verts, tying off 2 of them, 3 of them, because you got one carotid on each side in front, and you got a vertebral artery in the back on both sides. The carotids are much bigger than the verts, so they're more important blood supply to the brain. Okay, so you see, none of the great nutrition geniuses ever gets a Nobel Prize because they don't want the public to know about it. So you'll never hear about Chptr or Burkitt or the other great ones, Pritikin. McDougall will never get a Nobel Prize. Neither Esselstyn or T. Colin Campbell. Neither will Ornish. None of them, because they don't want the public knowing about this stuff. Okay, well here's my drawing of the mouse equivalent theory. It's actually, again, called the vascular hypothesis of dementia due to chronic cerebral hypoperfusion. And I call it the mouse equivalent theory. So all these things, atrial fibrillation, dropping your atrial filling in the left ventricle, cerebral hypoperfusion, you like the mouse. Congestive heart failure, you don't got much pumping power in your heart, you like the mouse. Obstructive sleep apnea, it's theoretical. It's a little bit of a different concept, but basically you're not getting enough glucose to the brain at night, or maybe hypoxic. You're like the mouse. If you're a diabetic, you overtreat it, you're hypoglycemic. You're like the mouse. Overtreat hypertension, you're like the mouse because you drop the pressure too low. If you undertreat hypertension, you cause intracranial atherosclerosis, you end up like the mouse. Okay, carotid stenosis, like we talked about, exactly being like the mouse. Aortic stenosis recurs, post-CABG hypotension, severe anemia. So anyways, there's a lot of things that make you like the mouse. And then, like I said, too, my theory is started talking about all these other details. If you increase stimulants, from MSG, caffeine, opioids, cocaine, all this stuff, and you don't increase oxygen glucose delivery, you end up having the equivalent of being like the mouse. And there's a whole bunch of things too. If you're low in magnesium, if you're high in sodium, you all end up being like the mouse. Okay, you're screwed. All right, here's Delatorre's book, Alzheimer's: A Turning Point. Like I said, it's a great book. It's a masterpiece. If you're interested in preventing dementia, you really should read that book. Okay, I actually think Torrey's book should be read first. Understand Torrey's comment. I made videos about him too. You can learn it all from me. You don't have to buy anything. You can just watch all the videos, do all this stuff for free. But I'm letting you know, Torrey's, I think, is a fundamental concept that you should use to understand the brain. And I say that after, I've been studying the brain for a long time in great detail. Know more than anybody else about it. I'm the one that fellowship trained neurologists come to me and I teach them about the brain. Okay, I got guys who've been studying the brain for 50 years. They come to me to teach them about the brain. Okay, and once you get Torrey, then you'll be able to understand everything else. I won't go into more detail about my theory until like the last part of the book because it puts everything all together. It's much more sophisticated and complicated. Okay, and this is where I was going over again what a joke Alzheimer's is. It's like I don't even like hearing that word. It's so stupid. And then all these people talk about, Alzheimer's is the most common dementia. They don't even know what they're talking about. They go, well, what is Alzheimer's? Oh, I don't really know. Okay. Something about beta amyloid and tau. Okay. Beta amyloid and tau, I don't even know how relevant they are. It's funny. This guy, Mattson, has these interviews. He's the guy who wrote the book about glutamate. He interviews all these neuroscientists, and he interviewed this guy. I think his name was Perry or Sperry. And he's devoted the last over 30 years of his life to researching tau, that intracellular neuron protein. And they go, well, does tau cause Alzheimer's, or is it time to prevent Alzheimer's? He goes, well, after studying tau for 30 years, I don't know. I don't know if it causes Alzheimer's or if it helps prevent it. And what I'm saying is, imagine there was a fire and you see a fireman at the fire. Does that mean the fireman caused the fire? No. The fireman is just there to try to put out the fire, okay? And it gets into a lot of nuance and semantics. We're not going to get into that, but the point I'm trying to say is, the idea of thinking that they understand what they're talking about when talking about beta amyloid or tau is ridiculous because they really don't. Even a guy who studied it for 30 years. And they might have a small contributing component to the disease, but they don't tend to come until later, till after the damage is done. They're like, in a basketball game, garbage time after you already know who's going to win the game. Okay, my theory, the neurovascular uncoupling theory, it's really the highlight of the book because it puts everything all together and it incorporates a whole bunch of subsets of ways of thinking about the brain into it. Okay. Now, the other question is, well, why did I even make the book? What's unique about this book? Why was it worth doing? Because I put all the drawings in. You won't find drawings of any of this stuff. And I've also learned more since I've written this book. And all the big dogs in neuroscience, I've read them, okay? Of course, I know Douglas Calathoresi Pretorius. Almost nobody knows about them. They're both geniuses. They deserve Nobel Prizes. Russell Blaylock, he did great work. He wrote a landmark, fantastic book around 1997, his excitotoxin book. And these other guys have done fantastic work. This guy, Martin Paul's an incredible genius. And there's a whole bunch of other ones. And I'll talk about their books and their theories and what they've written about. And the good news is, what's the whole point? When you talk about Alzheimer's dementia, it just leads you to stupidity. You go, well, there's nothing you could do. Maybe take the pill, Okay, and don't get me wrong. Schurzheis did say some good things. They say if you exercise, you dramatically lower your risk of dementia. If you eat a plant-based diet, you dramatically dramatically lower your risk of dementia. If you get your sleep, you dramatically lower your risk. So all of that is good. But then I'm laughing is Schurzheis, here's their book, Schurzheis, okay? After saying, like one of the most important things you do is get your sleep, they recommend you drink coffee. I'm like, are you stupid? You tell the person to sleep, but then you tell them to drink coffee and have the last cup until 2 in the afternoon. That's stupid. Okay, and then the other thing is, be skinny, avoid obesity and hypertension and diabetes. And then you tell them to eat a high-fat diet? That's stupid. Okay, give me a break, okay? And Greger says about the same thing. Coffee's good for you, good for your brain, and all this high-fat food is good for you. BS. The only good fat is fiber. Some of it gets converted into short-chain fatty acids, okay? And so people say, oh, I'm a jerk, and I shouldn't criticize people, and I'm never going to make any friends. Well, good. I'm used to not having any friends. I don't care. I'm just going to tell you the truth. And, I know, like I said, no one's ever going to hardly read my book or even talk about it. That's okay, and I won't get interviewed. That's okay. I'm still going to just tell the truth. I'm used to being that way, neglected, okay? And I joke about the mystery method because I thought that book was really funny. Oh, and then here's what I would describe as my teaching method. Basically, I say a lot of basic common sense stuff that everybody should know. And then I like to get into interesting details and then connect different areas of physiology, pathophysiology. I call that AOs, academic orgasms. So for anybody who feels overwhelmed at times, I'll always get back down into common sense, basic stuff that you're comfortable with. But I'm also throwing in a lot of stuff there that the so-called aficionado experts aren't going to know, so that they're entertained and educated as well. So that's just how my books are. They go all over the place, which I think is one of the strengths of my books. Let's see here. I usually only have about one illustration per page because the software word processor I'm working with, it gets kind of crazy if I try to put more than one picture on a page, which sometimes I do, but it's not easy to do. And what did I say? Something like, it's kind of like a crazy girlfriend who makes you put up with her games because she knows you don't have any good options. Yeah, I basically have to work with my software. Oh, what did I say? Oh, yeah, I joke around in my books, and some people get offended by this. Well, too bad. That's just how I'm going to be. I said, I'm proud of the fact that I'm aging much better than all the people I know, including my wife. At my age, 60 years old. In the younger days, we go to party. My wife used to be a turbocharger fox. She was like a combination of Anita Nazario and Marilyn Monroe. And she was real kind of stuck up. She said to me one time we were at a party, do you know what people think about when they see us? And I could tell she was up to no good, but I played along. So I said, what? She goes, they say, what is such a beautiful woman doing with such an ugly man? I said, I thought they were thinking, what's such a smart man doing with such a stupid woman? Now that I'm the better looking one, I could have taken advantage of the situation by sleeping with her friends. But I didn't, because I don't want to ruin those friendships for her, because she likes to visit them, and it gets her out of the house so I can have some peace and quiet. Okay, one of the dirty little secrets of modern medicine is that it's atheistic and it doesn't care much about the patient. Conventional medicine defines a standard of care for treatment of diseases, and the standard is always for low-functioning people. And a lot of people say, how could you say that? I care about patients, and medicine does care about patients. And my answer is that, look, if you cared about people, you don't poison them. Okay, if you give them drugs, these psychiatric drugs that cause lobotomy, you give these children attention deficit drugs that cause lobotomy, that's not love. When you love somebody, you do the right thing for them, even if it makes you lose money. Okay, and the right thing in medicine very often means losing money, and it almost never gets done. Okay, so that's what I'm saying. Let's see, and the standard of care to me is like a big joke. It's for intoxicated people, demented people. Sometimes standard care and optimal care are the same thing, but you always want to go for optimal care. And that requires a patient typically to participate in their care, which most patients really don't participate that much, but they'd be better off if they did. And it takes too long for a doctor to start explaining things to a patient. They don't get paid for that, et cetera, et cetera. So the whole point of this book is that you're on your own. Your doctor probably can't help you very much. And almost everything useful you can do, you do for yourself. But nobody wants to tell you that, because if patients actually realized that they could fix themselves on their own, then they wouldn't need the medical system. The medical system would lose money. So it's never going to tell the patient the truth that most of their health just depends on themselves. Okay. Yeah, like I said too, I got friends in internal medicine. They'll say almost all of their patients over 60 are significantly cognitively impaired. Another one said all his patients over 50 are mentally slow. In my own personal experience, most patients over 60, yeah, they're like cows. Yes, thank you, please. They're real slow. Most of my psychiatry doctor friends tell me most of their patients, they're not just have a psychiatric disease, they're also stupid, very low IQs or low cognitive function. Okay. And the reason why this is true is because anytime you work in a hospital, the people who are sick, most of the time, they're sick because they're ignoramuses, okay? They're alcoholics, or they're smoking cigarettes, or they have a whole bunch of bad habits. Don't get me wrong. Some totally healthy, smart people with good habits do get sick too. And they also get into motor vehicle crashes, and all kinds of things happen. But the majority of patients that doctors talk to in hospitals tend to be cognitively slow. That's been my experience my entire career, and any doctor will tell you that. Okay, that's why doctors tend to have these dopey personalities. Hello. And they're being very nice because they're trying to figure out, are you a typical dopey person, or are you a smarter person who's capable of having a more sophisticated conversation? Okay, and this is a slide. You've seen it before if you've seen my lectures. This is what it all comes down to. This is you at the beginning of the map. You are here. And hopefully you get started by middle age. And if you avoid the toxins, we've got a bunch of lectures on that. Avoid the vegans. Control your EMF. You got a good chance to keep the Johnson working, not need any pills or surgery the rest of your life, die when you're on average about 90. And if you don't do that, if you go down the process, like a typical person, processed food, meat, oils, all this stuff, you're going to end up on drug after drug, and then you're going to go for surgery. So it's going to be drug, 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 chop, 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 bye-bye money, dead prematurely. Okay, that's the usual American. Okay, and that's all the people who think they're sophisticated and tell me stuff. Oh, I eat healthy. And then they all say it's just genetic. I know it's genetic because my sister had open heart surgery, my brother had open heart surgery, and he had a stroke and all this. We all have the same thing. It must be genetic. No, it's because you guys all eat the same thing and you all have the same bad, stupid habits. Okay, typical American, they start getting fat and sick by their late 30s, early 40s, and then they just get worse and worse, and they start becoming irreversible in their disease. As William C. Roberts, he's like the best cardiac pathologist in the world, he said, if you feed a herbivore a high-fat diet, they all develop atherosclerosis, 100% of them. And we are herbivores by our physiology. We got flat teeth. Our jaw goes side to side to grind plant foods. We have a long intestinal tract, about 22 feet, just like a herbivore. Okay, we fit the herbivore all the way through. Okay, so that's the end of chapter 1. So we'll call it a night for now. We'll talk about this again in the future. Okay, hope that was useful to you.